Cautious optimism in Hamilton Health Sciences intensive care units at Jurivinski and the General.
Certainly the situation is much better today than it was a week, 2 weeks, 3 weeks ago.
With 33 COVID-19 ICU patients, down from a high of 54 at the start of May, Dr. Bram Rochberg says the number of people critically ill with COVID has plateaued and is now decreasing.
We're no longer on this upward trajectory where we have these number of patients that are being admitted far outreaching the number that are being discharged.
The number of ICU COVID patients at St. Joe's is down to 26 from 34 on Monday. However, both St. Joe's and Hamilton Health Sciences are still running their ICUs at occupancy rates around 120%, caring for COVID patients as well as many other critically ill people.
Way over capacity compared to pre-pandemic times.
Down the highway, Niagara Health is dealing with the same problem. Its ICU capacity is at 164%.
All this talk about this happens every year, right? With influenza, this happens every year. No, it doesn't.
Niagara Health's Dr. Karim Ali says the burden placed on ICUs by COVID is unlike anything else he's seen. He says the number of ICU patients with COVID is down at 23 today compared to a high of around 90 earlier in the third wave. And unlike in previous waves, the majority of patients are not associated with outbreaks.
It tells you that infection prevention control measures work, but this has also got something to do with the vaccines.
Dr. Ali says he would expect more outbreaks and outbreak-associated ICU patients in Niagara, given the community spread.
A big part of this is vaccines starting to blunt the effect.
Dr. Ali says they are also seeing younger, sicker COVID patients than previous waves, something Dr. Rochberg has noticed too. And while vaccination is working to fight the spread, people are still dying from the disease without their families in an ICU bed.
I had a patient that died in my last week. You sort of heard the nurse telling the loved one that, your family can't be here, but they told me to tell you that they love you.
This is real. This is not, we're not playing a game here. This is happening to us.
The mobile health unit here at Hamilton General is set to be ready to welcome patients by the end of the month. It's still being built despite the decreasing number of COVID patients across Ontario.